Imagine being the reason a patient gets the wrong medication, all because of one simple detail that wasn't communicated clearly. In healthcare, miscommunication isn't just a tiny mistake, but it can seriously cause harm. Every single one of us will deal with communication in healthcare at some point. Either we'll be the person explaining something to a patient, or we'll be the patient hoping that someone explains things to us clearly. I chose this topic because communication is something I want to be really good at before I start working in the medical field. I don't ever want to be the reason someone gets the wrong information or is confused about their health. My purpose today is to explain why communication in healthcare is so important and what happens when it goes wrong. Today, I'm going to be talking about 3 main points: how miscommunication harms patients, how miscommunication wastes resources, and how medical social workers help prevent these issues. One of the biggest dangers in healthcare is medication mistakes. According to the HIPAA Journal, writer Daniel Alder explains that misunderstandings about medication and follow-up instructions lead to poor outcomes, preventable hospital readmissions, and even serious patient harm. Miscommunication also causes a lot of confusion about procedures and treatment plans. A study from the National Library of Medicine by Dr. Sarah Halleck reports that many patients leave their appointments without fully understanding what was explained to them, all because the instructions were not clear enough. When patients don't understand what's happening, things can even turn into legal issues. The HIPAA Journal also notes that unclear communication is a major factor in malpractice lawsuits, something that is easily avoidable. But miscommunication doesn't just harm patients, it affects hospitals in a huge way. When communication is unclear, hospitals often have to redo tests and repeat procedures simply because something wasn't understood correctly. That is a huge waste of time and money. Poor communication also slows staff down. Halleck's research shows that communication failures create delays that waste time, increase stress, and pulls attention away from other patients in need. All of this becomes extremely expensive. Alder explains that fixing errors, repeating procedures, and dealing with delays all increase hospital costs. But improving communication reduces the unnecessary expenses and mistakes. This is where medical social workers come into play. Medical social workers are trained to explain things clearly so patients don't ever feel confused or unsure. They take medical information and break it down so patients actually understand medications, procedures, and follow-up care. They also act as a communication bridge between the healthcare team and patients. If a patient is confused, nervous, or unsure, social workers will bring these concerns to the doctors and nurses so nothing gets missed or misinterpreted. Because of this, patient safety improves. Alder also points out that clear communication prevents medical mistakes and helps everyone on the healthcare team stay organized. As I wrap up my speech today, I want to restate my main points: that miscommunication in healthcare harms patients, wastes resources, and even causes legal issues. But medical social workers help prevent these issues by making sure information is explained clearly and correctly. Working on this project made me realize just how easily communication falls apart in hospitals. People in healthcare work long shifts, are stressed and tired. Patients are scared and overwhelmed. And one missed word, one unclear sentence, or just even one assumption can have extreme consequences. I never realized how serious miscommunication is in healthcare until I researched it for myself. I also learned how much behind the scenes work social workers do that most people don't even realize. They're constantly making sure information is passed along the right way. They also step in to calm down stressed patients. Sometimes they even help nurses explain complex discharge plans. They fill in the communication gaps that doctors and nurses don't always have time to do. Something that stood out to me is how big a role social workers have in healthcare. A lot of people don't speak English well, or they come from different cultures, or they're elderly and confused. Without someone helping them understand what's going on, they could easily get the wrong medication or miss important instructions. Social workers help protect patients by making sure nothing gets lost between languages, cultures, or emotions. That's a huge part of patient safety that rarely gets talked about. This project also helped me understand what kind of communicator I want to be in my future career. I learned that being clear and slowing down isn't just polite, it's part of keeping patients alive and safe. I want to be someone patients feel comfortable asking questions, not someone they're scared or confused by. I want people to leave a conversation with me feeling confident, not unsure. And in my future job, these skills will matter every single day. Communication will be the biggest part of my role. I'll make sure to check for understandings, repeat important information, and ask patients to repeat their procedures back to me so they know exactly what to do. No guessing, no assuming, no leaving someone confused, all because I rushed. Clear communication can truly be the difference between a patient getting the right treatment or the wrong one. And that should be taken very seriously, as every single person who works in healthcare, including me someday. Thank you.